I just want to thank everybody for being here. My name is Luis Vazquez. I am the chairman of the National Hispanic Chamber of Commerce and Health, and also a member of AHHE. The director of the New York Regional Office of Puerto Rico Affairs, representing the government of Puerto Rico, Luis Fortuño. Aquí tenemos a Luis Balzac, un amigo, un aplauso bastante grande.
Buenas noches a todos. ¿Cómo están? Bien. I guess this is what it's all about. I said it a few times, and I can't say it enough. This office is here to collaborate and partner with everyone. I have an open door policy. We play no games. The office of Governor Luis Fortuño is here to help every single one that we can, and we will. So this is how it connects to Puerto Rico tonight. Our keynote speaker, Jaime Torres. He is the new regional director for Human Health Services that covers New York, New Jersey, the Virgin Islands, and Puerto Rico.
I don't want to take too much time. I'm looking forward to hearing from Dr. Torres, but I just want to remind everyone about the Managers Council. It's we grew this to try to help young Latinos who are coming up in the healthcare field to get connected, get network with their colleagues throughout the city, and be able to help them as they continue to grow in their positions in healthcare. So I invite you to join the Managers Council and work with us to develop programs that will motivate these young managers that are coming up on the ranks in the healthcare industry. So I invite all of you to please join us in working together to make this happen. Thank you very much, George.
Muy buenas noches a todos. My name is Miguel Centeno. I am the Director of Community Relations for Aetna's Northeast region. I am very pleased to be here, as I'm always pleased to be at an AHHE event. We are very pleased and proud at Aetna of the role that we have played in helping to shape this debate. Our chairman and CEO, Ron Williams, was very heavily engaged in this entire process, in frequent discussions with President Obama and frequent discussions with congressional leaders, because we felt, just as the president does, that it is a national disgrace that tens of millions of people in the United States of America in the year 2010 still do not have access to health insurance. And as all of us here know, a significant proportion of those that are uninsured are Hispanic. And so we actually have done something special for you as well. We actually have developed teams that are specially designed to meet the needs of hospital administrators. We're able to put together specific packages of health insurance options if you are a hospital administrator. We have customer service representatives that are specially trained to understand the needs of hospitals and their employees. So again, great to see all of you, and we look forward to seeing you at the Gala in a little while. Thanks.
Mike Melendez.
Dr. Jaime Torres, Doctor of Podiatric Medicine, Master's in Science, was named Regional Director of the New York Regional Office for Health and Human Services by Secretary Kathleen Sebelius on April 6, 2010. As the HHH, as the Health and Human Services Regional Director, Dr. Torres serves as the Region 2 representative of Secretary Sebelius and helps coordinate the implementation of departmental policies and initiatives in Region 2, which includes New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands. Today, almost a full year later, exactly 3 days short of a full year, I now have the honor of working together with Dr. Torres in his new role as Regional Director of Health and Human Services. I also have the privilege of welcoming and introducing him tonight to address AHHE. Dr. Torres.
So I want to thank George and AHHE for this great honor, and also Luis Balzac, wherever you are, Luis, for having us here. And for this is my first reception after becoming regional director a couple of weeks ago, so I'm still fresh out of the box, okay? Finally, in March, the President Obama and the Congress passed the historic Affordable Care Act with the promise to improve the health delivery, reduce cost, and make coverage available to all Americans and improve the quality of life, quality of care of every person in the nation. So we are here to tell you that help is on the way. It has been now over a little bit over a month right now, and health insurance reform became law, and it will take several years that we learn to make sure that everything will be implemented. But finally, reform is delivering some real benefits to millions of Americans. Beginning last month, 4 million small business owners, and this was referred earlier by Mr. Centeno, will become eligible for a tax credit this year that potentially will be worth tens of thousands of dollars for those small businesses and will help millions of small businesses to provide coverage for their employees. As of July 1st, Americans who are uninsured because of pre-existing conditions will be able to buy affordable insurance through the high-risk pools, which is a temporary pools that will end in 2012 when we have the exchanges. So basically, this is a measure where everybody will be able to afford health care for the first time in over 2 or 3 generations. And beginning in June, businesses will be able to provide coverage to retirees who are not eligible to Medicare. So this is, again, something, how many parents are here, people who are ready to retire at 55, 56, and they have to stay a little bit longer because they're afraid of health coverage. And just a few weeks from today, on June 1st, senior citizens who fall into the famous or infamous donut hole, they will be able to get a $250 check to pay for medications. And the famous donut hole will disappear in 10 years. And thanks to the Affordable Care Act, health plans will not allow to deny coverage to children with pre-existing conditions or dropping people from coverage when they get sick beginning this summer. And yes. And something very important to the families. For the first time, children 18 and older up to the age of 26 will be able to be covered by their parents in their insurance. So if your child graduates from high school, go to college, he will be able to remain in your coverage until the age of 26. And lastly, I want to remind you of some of the important changes that have already taken place thanks to the American Recovery and Reinvestment Act that happened in 2009, which affected many, many people here, especially community health clinics. Ultimately, we will have a system that provides more control for consumers, more accountability for insurance companies, and more affordable choices for the uninsured Americans. This is what change looks like. And it is the promise of this administration that we will keep, as we keep reform to go as well as possible, to make sure that this will become a reality in the lives of American families throughout the nation. My office is open here for you, really. What I meant that we want this office to be re-energized, I mean it. I'm here to respond to your needs. I'm here to make sure there's a link between Washington and the region too. So in any way that I can be of use, mi casa es su casa. Thank you so much, George, and for the invitation.
I also want to just really thank our sponsors. You know, we made a commitment to our regional and national partners that we would have X number of events per year. So this is fulfilling our commitment of having our 3rd event recognizing our partners. So we even have the old banner there. So we just want to recognize AETNA and as our national partner, as well as our regional partners, New York Presbyterian, HealthPlex, Health First, North Shore LIJ, and Inlandnet. So I want to thank them and give them a round of applause.